Pleased to introduce Dr. Sakinat Baiyewu, who's the Head of Health and Wellbeing Department at CAHN, who's going to kindly be delivering this webinar today for us. So I'll pass over to you, Sakinat. Thank you.
Good morning, everyone.
Morning.
And I give you a warm welcome to today's session. Let me share my slides. First of all, I congratulate the Birmingham City Council for commemorating the Black History Month with other nations and other groups that are celebrating it. It's a good initiative. Well done. So my name is Sakinat from the Caribbean and African Health Network, and I'll be delivering the topic, Building Trust, a Community-Led Approach. I'd like to give you an insight into what CAHN is. CAHN is Caribbean and African Health Network, whose vision is to end health inequalities and wider disparities for the Caribbean and African people in a generation. And I'll give you just a minute to read through our mission, which focuses on ending racial and social injustice for the Black people. And our objectives focus mainly on working in collaboration with African and Caribbean faith and community organizations in order to strengthen their structures. We build partnerships across various sectors. We engage in continuous consultations with various groups in order to be able to improve the health outcomes of the people and fight health inequalities. And we also champion the work of the Black and the Caribbean people, the African and the Caribbean people, to promote its assets. And we do all this in a bid to influence media policy. We have so many health intervention and educational programs, which I'll be giving you insights into shortly. We have a very robust research system at CAHN. Then we are also open to membership and support. CAHN has six major health priorities that is built on trust. And the first is CVD, cardiovascular diseases. We have so many interventions and so many research that are ongoing on CVDs in order to be able to improve the health outcomes of our people. Also cancer, we have so many research going on at the moment on cancer. We have a whole unit at CAHN that is dedicated to improving the mental and emotional health well-being of our people, because we have culturally competent counselors that deliver culturally appropriate services because they understand the cultural nuances of our people. I'll be giving you brief insights about that as well. And we do all this in a bid to improve the trust as to why our people have to engage better with the system. So another health priority we focus on is respiratory conditions, immunological conditions, reproductive and sexual health. And we do all this in such a way that we're able to earn the trust of the Black and Caribbean people living in the UK, as well as the trust of the service providers ranging from the NHS to other social service providers. And we deliver culturally appropriate services. We improve health literacy. I'll be giving you insights into all this shortly. But before we talk about the issue of trust, I need to take us a little bit into the memory lane. I'm sure we'll all be familiar or must have heard about the Tuskegee syphilis study, where the Africans were subjected to inhuman treatments. We had about 399 Africans that were subjected to experiments on syphilis. And even when penicillin anointments was proven to be 95% effective in curing syphilis, this cohort of people were not allowed to take it. So that imprint remains in the hearts of so many people. Then up to the Elder Hay organ scandal of when organs were being taken away from people without their consent, up to the scandal of the Windrush in 1946, this still has a huge impact as to why the Caribbeans in particular, have an issue with trusting the system. And, the whole issue about how they were not given treatment and they were treated as less humans and not having access to healthcare services, up to the wide maternal disparity rates, because the question continued to arise, why does a Black woman is 4 times more likely to die compared to her white counterparts? And, we have so many pathetic stories of how the Black pregnant woman is being treated in inhuman conditions at antenatal clinics and so on, up to the issues of mental health care treatment, where we have most Black people, when they report for a mental health support, many times they are misdiagnosed and they're subjected to harsh treatments, and this further worsens their cases. They are put under physical restraints and so on, up to the scandal of the COVID-19, which impacted the whole world, why there was a higher rate of mortality among the Africans and Caribbeans living in the UK, and the issue of why they were not given the protection, the PPEs, from during COVID from being infected. So all the imprints of all these occurrences in the past has an impact on the health-seeking behavior of people. And why CAHN? So CAHN is a Black-led organization that helps to bridge the gap of poor engagement. Over a very long time, the Africans and Caribbeans living in the UK have been tagged as a hard-to-reach population, and they don't engage well with the system. Of course, I'm sure you'll agree with me that part of the reasons mentioned in the previous slides might be responsible for that, and lack of trust. They don't trust the system, and the whole bureaucracy, the structural bureaucracy, and also inadequate knowledge. And you'll always also agree with me that structural barriers exist. There's a poor Black representation on seats where decisions are being made. There's an African adage that says that you cannot shave the head of a child in the absence of the child, because the Black people know where the shoe pinches. You can't make decisions for them in their absence, but when they're not represented and you make decisions for them, it doesn't work many times. So poor representations on seats where decisions are being made, and benchmarking to the majority of the population. The impact of this was very evident during COVID, when we had higher rates of mortality among the Black, because all gadgets, all equipment, most interventions were not even focused to them at all. Even to the pulse oximeter not calibrating because of skin pigmentation and so on, up to the issues of racial discrimination, conscious and unconscious systemic bias. So all these have been long-standing issues. So CAHN serves as an organization that sits in between the community people and the service providers, and we sit so much on trust. We are accepted by the people because we are trusted. And we emphasize so much on sincerity, open communication. We have a very strong, robust research system or research structure. I'll be talking about that shortly. That is reliable, and whatever we publish is evidence-based. And whatever we do, we are committed to it as well, because we have so many programs and interventions that have been long-standing since the inception of CAHN and are still in existence up till date. Then CAHN has always been known for integrity. We have a track record of excellence in delivering our services. Then we are also competent. We have competent, skilled workforce. We have a very strong skilled workforce. Then we are consistent in our service provision. And I'll be speaking about how the bits of all this highlights I've mentioned, how they relate to the issue of trust shortly. So at CAHN, we lay so much emphasis on open communication because it facilitates a honest and open dialogue. And you'll agree with me that this open communication, where the patients are they easily express themselves, they feel comfortable, and for the fact that they also know that they will receive some kind of mental support, they have a sense of psychological safety. It's possible they'll trust such a system. Then particularly for the fact that CAHN focuses on addressing health disparities and inequalities, makes CAHN another organization that a lot of Black people they appreciate so well. Then CAHN also aligns with ethical foundations, and we do all our staff, we always go from time to time to trainings on why trust is very important, and patients compliance. You'll agree with me that if all this is put in place, there's a high chance that patients are going to comply with medications, their medications and whatever interventions you offer to them, particularly for the sake of patients that on chronic illnesses that might be having a long-term engagement with the system. If trust exists, it's likely they would comply, and you would agree with me that this is going to improve their health-seeking behavior and health outcomes. Then on crisis management, also very important to have a background of trust or to be known as a trusted organization. Because I remember during COVID, our helpline received so many calls that should we take the vaccine or not? And when the question comes, why are you asking? They tell us because we don't know if they're trying to experiment with us. So that issue still remains. The imprint of what has been discussed in the previous slides of how people have been subjected to experiments still remains as to reasons why people are poorly engaging with the system. Sorry. So at CAHN, we have a very regulated structure. We have a research and innovation structure, which at the moment we have about 26 ongoing pieces of research. Some are independent and some are done in collaboration with different groups and individuals. Then we have a very strong community empowerment structure as well. And in our research department as well, I forgot to mention that we have all issues being discussed are related to the Black and Caribbean people and focus on poor engagement with the system and issues that relate to their health, ranging from menopause to sickle cell to mental health illnesses and a long list of so many topics. Then we have the community empowerment department and advocacy as well that has so many initiatives. We have drop-in sessions, we have family sessions and so on. Then the health and wellbeing department, where I belong to, we have so many programs, services and initiatives, and so many of these programs some of them are sponsored by the NHS and various organizations. And this was built because the system has trusted us for quite a while. Then we have education and training department as well, where we have students from various universities, such as the Manchester Metropolitan University, Salford University. We have nursing students coming for training to be able to have a feel of what it is to work in a Black-led organization. Then we have interns as well from the various departments, from the various universities across the nation that come in to have a feel of what it is to work at the Caribbean and African Health Network. So, and we do all this under the compliance of our corporate affairs unit. The corporate affairs unit oversees the day-to-day activities and ensures that all activities within CAHN are effective and they are standard. So like I mentioned earlier, we have a robust counseling service and we have trained counselors that are culturally competent. And a lot of times when we have calls into the counseling, people seeking for counseling help, the question always arises, are they Black? Means that the issue of trust, the imprints of all what has happened in the past still remains in the hearts of so many people. And they have a sense of have a sense of psychological security when they realize that the person are going to attend to them is Black. So, and our counselors are competent to deliver services, and our counseling service we have attended to over 3,000 counseling cases, and it also has a track record of excellence. Then we have the hospital discharge service as well that helps our clients, the service users, settle back into their home after the period of being admitted to the hospital. We help them settle back into their home, making quick meals, helping them recharge their phones, get onto their Wi-Fi, and helping them settle into their homes. And we do this as well in a culturally appropriate manner. Then, and we have the Green Arts and Wellbeing Service that helps to connect. The written publication by the Home Office states that there's a connection between mental well-being and green and arts. So we lay so much emphasis on green and arts, where we connect our people a lot of times to their origins, to the origins of the arts work that are being done in African and Caribbean countries. Then we have a strong advocacy unit as well that focuses on, we do so much on family advocacy sessions, we do drop-in sessions, we do so much on domestic violence. Then we have the CAHN helpline that runs for 24 hours in a day. And I still talking about trust. I mentioned consistency. If a group knows that the service you're rendering is not consistent, it's haphazard, it's likely they will not engage. I proudly boast about the CATIP session, which we have been having as far back as 2020. It holds every Saturday all around the year. We host about 200 Black people per session living in the UK, and we have consultants from different specialisms that come in to deliver sessions that last about 45 to 60 minutes. And this has been on as far back as 2020 up till date without skipping a single date. And you'd agree with me that it's a lot of work and a lot of effort. And altogether, of course, this is a very old data. We've had over 6,000 attendees for all the sessions in total. Then, as in a bid to also engage better with the community, you'll agree with me that relationship building is very, very important. CAHN builds relationship with the grassroots, with grassroots organizations within communities. So, and this is one of the health fairs we had in somewhere in Manchester. Then, like I mentioned earlier, the trust should exist between the service providers and the service users. CAHN serves as that organization that bridges the gap. And we have been known, we have a track record of excellence. We are trusted by the NHS. NHS commissioned us to deliver the Core 20+5 project. And the Core 20+5 project, I believe so many people know about it, and the bits of having to recruit connectors and so on, where they help develop a pathway, where they co-design pathways for interventions with the service users. And the CASI screening, knowledge access screening for improved health. CASI is an initiative by CAHN, and it was sponsored by the Salford Council. And the objective of this was also to, we empowered lay people within the community, people that had no knowledge about health, ranging from artisans, barbers, hairdressers, Uber drivers that were Black. We gave them knowledge on cardiovascular diseases. And we taught them how to initiate a discussion such that our people are more health conscious and they improve their health seeking behavior. And we celebrated the ambassadors recently because we were able to recorded excellence. Like I mentioned, all our interventions at CAHN are evidence-based. We conduct research, pre-intervention research. We conduct research to be able to know what the needs are and how to tackle them. So the CASI intervention was a structured intervention to meet the needs of the people. And after we had part of the results we got at the end of the intervention was people engaging better, people taking their medications better after the intervention. And it's still in process, it's still in continuity, it has not ended. Then we have the maternity standards for improving health outcomes, perinatal and infant mortality health. So these are ongoing projects that we are doing at CAHN in a bid to influence health policy of the people in the UK, the Black and Caribbean people, the African and Caribbean people. And like I mentioned earlier, we focus so much on research at CAHN, and before any intervention takes place, we conduct research, and our research is fostered by trust, and then we ensure a rigorous research methodology and the whole process of the research. And the system, so many organizations, individuals, groups, including the NHS, has trusted our research such that they see us as a credible organization to have dealings with, to be able to conduct step-down interventions to Black, African and Caribbean people living in the UK. And we have also won the interest. We have also won the trust of the community people as well, which makes it one of the strengths of CAHN. And that is why our interventions are always accepted. I won't be boring you so much with our research and innovations unit. I won't be boring you with this web. It's a very complicated web of how we conduct research and how we're able to undergo our interventions in CAHN. But the major important thing is that our research they expose real life situations of things that happen in the grassroots, things that happen within the communities, and they give insights into health interventions which we are going to carry out. So at CAHN, we do so many things based on structure. Like I mentioned earlier, we engage with leaders from Black-led organizations, faith groups, and individuals. And you'll agree with me that to achieve a meaningful, sustained improvement in health outcomes, trust is very important. Building a healthy relationship between healthcare providers and the recipients is very, very important to help people engage better with the system. And trust for a holistic welfare thus, for the holistic welfare of communities and individuals alike, trust must be diligently nurtured and must be upheld at all times and must not be broken at any point in time. While this is an old quote. Trust is like a mirror. Once broken, can never look the same way again. But I don't agree with this quote anymore because I believe this quote was when there was no AI. I believe so many things could be done to break to heal a broken heart. So the hearts of so many people have been broken in the past, and that is why CAHN is trying to mend so many broken hearts. And it's up to us, all the precedences that have been laid from the past, in the past slides, from our predecessors, the precedences that have been laid that is still affecting the health outcomes of people up till today. I believe our generation should be able to do something better, to be able to, and not to reopen the healing wounds. So it's up to all of us on this call to do something better, such that we are able to fight health inequalities. We support people as much as we can, and such that people will be able to engage better with the system, to be able to improve the health outcomes. And the next generation does not tell the same story we are telling now. So at this point, I think I have come to the end of my presentation. Thank you so much for listening.